Hello everyone, my name is Dr. Salil Jain. I am working as a Senior Director and Head of the Department of Nephrology and Kidney Transplant at Fortis Memorial Research Institute at Gurgaon. Today I am going to discuss about the kidney diseases. We have all seen that in last few decades, the kidney disease has become a kind of an epidemic. In last century, there was hardly any patients and hardly any hospitals or very few nephrologists were needed. But here in last 1 decade, we have seen that the number of patients with kidney disease has increased a lot. Why is this happening? Most likely, I think the number of patients with diabetes and blood pressure are increasing all over the world, especially in India. Because of the lifestyle changes, there has been a surge of patients who have become diabetic and hypertensive. India is now being called a capital of diabetic disease. Most common reason for this is, I think, the dietary changes and the sedentary lifestyle changes that we are seeing nowadays. Similarly, I think the salt intake, the sugar intake, the fast food, lack of exercise, most people sitting, not doing the exercises. This has caused a increase in the incidences of diabetes and blood pressure. And since diabetes and blood pressure are the most common causes of kidney disease, I think that is the reason why we are seeing a lot of kidney disease patients coming to us. And that's why we see that there are a lot of dialysis units mushrooming all around us. So, having said that, the diabetes and blood pressure being one of the commonest cause for kidney disease, there are other causes also, like what we call as glomerulonephritis. These are a group of disease where the immune system, which is actually supposed to protect us, actually starts harming our own organs. These are called autoimmune diseases. And sometimes this immune system, which is supposed to protect us, when it starts attacking our own kidneys, it is called glomerulonephritis. This is also very common reason for kidney damage. Apart from this, uh, urine infections, kidney stones, medications, high protein intake, and uh, high intake of the painkillers. These are also known to cause a lot of kidney damage. There are hereditary diseases also which contribute, but mostly what we are seeing nowadays is the diabetes, blood pressure, autoimmune diseases, and diseases secondary to painkillers and urine infections and stones. These are the most common reason for kidney diseases. Now, since I've told you that the diabetes and blood pressure are the most common reason for kidney disease, how to prevent one from getting this kidney disease? So, if you are a diabetic and high blood pressure, you need to monitor your sugar levels and blood pressure. For diabetics, I would suggest there is a very good test which is called glycosylated hemoglobin, or in short form, it is called HbA1c, and it should be done every 3 months. It gives an average of blood sugar over a period of 3 months, and if it is kept around 7, then I think your sugar control all over the last 3 months have been good. And since the sugar control is good, it's very unlikely that your kidney, eye, nerve, heart will get damaged because of the sugar problem. So monitoring of your sugars is essential. And for controlling your sugars, taking medications regularly, doing exercise regularly, looking at the uh, sugar levels now and then, and making sure that you are following up with your sugar doctor or diabetic doctor is very, very essential. Similarly, the blood pressure patients, they should also target their blood pressure somewhere less than 140 by 80. And if they are already having a kidney disease, then it should be somewhere around 130 by 80. And I would suggest that they should also monitor their blood pressure regularly, at least once or twice in a week would be good enough. And in case they find that the blood pressure is higher than that, they should contact their physician and ask them to give the appropriate medication. So this is, I would say, will protect if you are controlling your sugars, if you are controlling your blood pressure, if you are avoiding painkillers, doing regular exercises, decreasing your salt intake, if you do all these things, there are very less chances that you will get a kidney disease. But in case, and to make sure that you are not getting the kidney disease, one way is to measure your blood test, on the regular intervals once in 6 months, and check whether your creatinine and urea levels are okay or not. But the more sensitive and easy way is to monitor through your urine. If you do a urine routine examination and if you see that you are passing albumin or protein in the urine, then it's the first indication that your kidneys are getting damaged. And this should be seen by the physician, and they should quantify this by doing urine for microalbumin, or what we sometimes call urine protein creatinine ratio or urine albumin creatinine ratio, or 24 hours collection of your urine for albumin. If you do these tests, they will be the most sensitive, and before your kidney starts getting deteriorating to a significant level, we can, as a nephrologist and physicians, we can actually help your kidney to recover back and avoid further kidney damage, protect you from dialysis, kidney transplant. So a simple urine routine microscopy test will be it's a cheap test, and it's available all over uh, all the cities, towns, and even villages. It's available. So I think all the diabetics and blood pressure patients should actually do a urine routine, and every person who is above 40 years, at least once in a year, they should do a urine routine examinations. And this will help us in catching the patients at a very early stage if their kidneys are getting damaged, and this will prevent further deterioration of kidneys and will protect you from dialysis and kidney transplant. So once you have monitor your this thing, there are few medications which are called AC inhibitors, ARBs, drugs like telmisartan, losartan, ramipril. These are medications which actually help in protecting the kidneys. Then there are sugar medications which we call as SGLT2 inhibitors. These are also kidney protective. There are new drugs like finerenone and special kind of insulin which are also helping in weight loss. These three or four things can be added over the control of the blood pressure and sugars to help you maintain your health and avoiding the kidney diseases. Just a small word about young people, that I've noticed that we have been having a lot of young patients who are coming with kidney disease, and I found that uh, the most common reason for these patients having young patients having kidney disease is, one is the sedentary lifestyle, then smoking, excessive eating of the fast food which are very rich in salt and oily things. The third thing is that they are using a lot of painkillers because they are under stress, working long hours, and they have sitting jobs. So they are using a lot of painkillers. Then there are a group of young people who are doing a lot of gymming, and they are using a lot of high protein supplements. And I found that unless you have a discussion with a physician, please restrict the use of protein supplements. And these can be, if taken excessively without supervision, they can definitely damage kidneys. So try avoid taking that. And overall, I would suggest that make sure that you are hydrated well and avoid salt and excess sugar in your diet and do exercise. Now, one thing that I would like to say, that recent API has recommended and made sure that there is a World Edema Day on 25th September to be celebrated every year. And why is that? That edema, or what we call as swelling all over the body, or especially in the legs, is one of the most common symptoms that we see along with the kidney disease also, but it can be because of the low hemoglobin, liver problems, thyroid problems, heart problems. So this uh, day has been being celebrated so that the patients, or in general population, they can get a lot of awareness about uh, that if there is swelling over the legs, they need to see a physician immediately. So, having said all these uh, things, and I hope that most of you will try to follow and monitor your blood pressure, sugars, exercise, and diet, and try to do at least 40 minutes of walking every day and remain healthy. All the best. Thank you.